Okay. Welcome everyone. This is our ninth episode of World Talent Economy Forums. Today we invite our guest from Australia, from Federation University. He is Dr. Aziz Rahman. He is a doctor, he is a researcher, and most importantly, he is a social media influencer. He can reach many people. So, hello, Dr. Adi. Can I know about you, about your professional background, and what's the present situation in Australia?
Hello, Dr. Shaif. Thanks for inviting me. It's a great privilege to be in this forum. So, if I tell you about my background, I'm a public health specialist. I did my medical graduation, and after that, I followed my career in public health. I finished my PhD in Australia, and after that, I've been working for the last 15 years in different organizations, mainly in academic organizations. So at this moment, I'm working in Melbourne at Federation University Australia as an associate professor of public health. In terms of this current situation of coronavirus, I had the opportunity to work internationally. I worked in Bangladesh on outbreak investigation, specifically looking at these infectious disease outbreaks. And I also got the opportunity to work in Australia in Department of Health as a public health officer, where there was swine flu outbreak back in 2009. So basically, I'm an epidemiologist to look for the risk factors for diseases and the prevention of diseases, both communicable and non-communicable diseases. So if you think of this coronavirus situation in Australia, I will say Australia is one of the countries in the world who has done successfully managing all of the situations in this pandemic situation in Australia. If you look at the data until yesterday, we got 7,118 cases, and out of them, the number of deaths was only 102. And if you look at the data over the period of last 4 or 5 months, the peak was in the third week or fourth week of March. Well, we had lots of cases. But down the track, over the past month, the number of cases has gone down. Now, if you look at the situation of all of these cases that were reported in Australia, most of them, almost two-thirds of them, all of these infections came from overseas, and almost one quarter of them had the contact with suspected case. And if you think of the community transmission, it was only 10% of the cases. So that is overall situation. And what happens in the affected people, most of them are young age people, mostly 20 to 29 years. And if you look at the deaths, most of them were older people, starting from 70 to 89 years. So what's happened when the coronavirus situation was declared in Australia, people, especially the younger age, they're thinking, oh yeah, look, all of the people who are dying, they are old people, so we are immune, we are safe. They try to ignore the situation. But down the track, there are lots of discussion on this, and there are some policies and implementation on this. For all of this, we were successful in containing this virus. Now, if you think of the public reaction at the very beginning of this pandemic situation, there was a chaos on this, and I don't know from where they came to know. Probably there will be shortage of foods and supplies, and specifically, that was quite funny thing. What happened in Australia? People were crazy in buying toilet papers. I don't know what is the relationship with toilet papers with COVID-19, but we faced this situation. People were panic buying these toilet papers, and there was shortage of toilet papers. And there has been lots of media discussion and lots of funny thing in the media. They are saying, look, so it is being produced in Australia, so you need not to worry that those are coming from China. Then you are thinking, okay, you need to stock this. And what happened? They were also started their hand sanitizer, liquid soap, even some grocery items like pasta and all of these things were really shortage, and people were really panicked. So what the government did, they tried to reassure the people, look, sir, you don't need to panic, and we are not closing all of these stores, so you need to calm down. But, when the panic situation starts in the community, people usually follow their relatives or the friends, and they also start doing the same thing. And then after a few months, all of these situations come down because they thought, oh yes, there's no crisis on this, and now the situation is quite normal if you think of the normal lifestyle of the people. Unfortunately, there is some situation like racism was there when there was an outbreak of this. So there are some media reports, especially the public transport drivers. They were attacked while they were from China, and they were saying, "Look, so we have been attacked because we thought people are saying you brought this virus, so we go back to China, although they are the permanent resident citizen of Australia." So this type of racism happened, and the local government and the prime minister heavily criticized this and discouraged regarding all of this stigma and panic situation. Now, if you look at the what are the situation that how the country as a whole handled the situation, I would say Australia took a precautious step. So rather than going at a straightforward for locking down and then easing the restriction, they thought that we will prepare for a minimum period of 6 months. So they took the preparation for a 6 months period, and what they did stage restriction, starting from stage one, stage two, and stage three. And in terms of stage three restriction, when there were only few people could go outside and few people could stay inside, and specifically the limitation of visitors for indoor and outdoor gatherings. Through this, what happened, few of the people, irrespective of the country, whether you are in Australia or whether you are in any part of the world, some of the people, they will follow the rules, and some of the people, they will ignore the rules. So that also happened in Australia. Initially, people ignored this thing. They were, when there was a sunny day, and then government said, "Oh, look, so if you don't follow the rules, then we need to impose penalties for this." And what they did, they imposed penalties. They did the penalty of almost $1,600 if you violate the rule. And it is not only about the penalties, but what they did, they also imposed these penalties even over the weekends, and they broadcasted these penalties through social media, through all of these news channel. Then people became really cautious and they became aware to avoid this huge penalty. They tried to follow the rules. So sometimes, when there is some rules and regulations, but if there is no strict implementation, there is no point of using those policies. So I would say Australia did really good in that circumstance. Other than that, what Australia government did, initially they said, if you can work from home, you should stay at home and you should work from home. And most of the organization did this thing, apart from the frontline and essential health workers. Not only health workers, essential workers, say for example, who are working in the stores and grocery shops. Apart from the hospital settings and GP setting, most of the people started working from home. There was a debate regarding whether the schools should be open or the schools should be closed. Although Prime Minister always said, "Look, the schools should be open," but the parents were really conscious whether there'll be a chance of spreading the infection, and there was a debate regarding this, whether it should be open or it should be closed. But the Prime Minister always said, "Look, there is no evidence in the world that children at the school they can transmit the virus." But anyway, some of the parents were really cautious, and then different states took different initiatives. And I'm in Melbourne. So in Melbourne, they took the decision of closing the school a bit later on. But what they did, they like not only in Melbourne, all over Australia, they tried to implement online classes even for the young kids. And that was a new experience for the kids, not only for the adults. All of the universities in Australia, they went to the online, specifically the school kids. That was a new experience for them. And it was a bit challenging for the parents as well, because sometimes they also need to be beside their children to go through all of this online system. Other than that, there was a restriction regarding the closure of cafes and restaurants, and also the social distancing, even in the grocery shop and the cafe and stores. They used to do all of this only takeaway, no sitting arrangements there. All of the sitting arrangements were removed, and there were marked in the floor where people used to have this social distancing. So all of this limitation of indoor and outdoor gatherings that happened for a couple of months. Now, when the number of cases were going down, then the government started easing the restriction. But as told you, Australia took a precautious step, so they did not do this thing all on a sudden. They also decided to ease the restriction stage by stage. So at this moment, we are at stage one of easing of restriction. So that means only 5 visitors can visit our home, and in the indoor and in the outdoor, there is a maximum number of 10 people that can gather together. And this restriction will move to the second stage from 1st of June, when there will be more visitors. Every 20 visitors can come to a house, and there is more relaxing of restriction in outdoor. So what Australia is doing, they are trying to do all of this in a stage situation. Now, if you think of the public health message, so they are always doing this public health awareness message, specifically talking about the hand hygiene, talking about the cough etiquette, talking about the social distancing. They started preaching all of these messages um, starting from this outbreak. And what they are doing, they also started posting this message in the social media, Facebook, Twitter, LinkedIn, and also in the news media, TV channels, and in the newspaper. So that was really, really good. The other thing is massive testing. Australia was a pioneer in doing probably the highest number of testing today. So they did massive testing. At first, they tried to do the testing at the GP centers. So if there is any suspected patient with any symptom, they used to go to the GP centers and they used to have this testing done. And now, with the increasing number of cases and with the concern of safety of the general practitioners, what they did, they moved this testing into specific hospital settings. And the patients don't need to go to the GP settings and have this risk of transmission of virus to other patients. They need to go to the hospital settings, and they started doing. And then down the stage, what they did, they tried to do even the drive-through testing, even in the parking center. They are saying, "Oh, look, so you just need to do the test, even if you have very minor symptom." And later on, they broadened this testing criteria, and at this moment, they have done more than 1 million tests. And I will say, if if there is more tests, there is a more chance of detection, specifically for the community cases. And that happened in Australia. There's lots of tests and massive relaxation of criteria for testing, and that was one of the successful steps that they took. Other than that, I will say regular briefing by the health minister, by the local state government, on even by the prime minister at regular interval. That also assured people that they need not to panic and what's going on, because even in this pandemic situation, everyone is in a stress situation, and everyone was cautious what's happening, and even with the border closure, what will happen to those people who are outside of Australia, or the people who had a plan to go outside of Australia. So they are always in a panic situation, apart from the risk of transmission among themselves. So therefore, I will say that is also a good initiative from Australian government. They always updated people almost every alternate day, either from the health minister or from the head of the state. They always try to update us what's happening and what is the next step. And Australian government also did some good initiative. I will say that is applicable especially for the developed countries. They change all of this face-to-face consultation with general practitioners to telehealth consultation. And so patients even don't need to go to the practice settings. They can talk over the telephone or even with the video chat. Not only with the GPs, they can also talk with a specialist. So that was a very good initiative. Other than that, what they did, they have also organized home delivery of medicine, specifically if they fulfill the criteria for the older people who really struggle to go to the GP centers to grab their medicine. They used to get this service delivered at their home. So that was really, really good. And Australian government also did, they also prepared themselves, our hospital settings with more ventilators, and they also had more respiratory clinics, so that if there is any unexpected situation of rise of very acute cases, they could handle this. But unfortunately, they did not go at that stage as predicted through different models. Uh, I will say there is also a national task force. What Austrian Prime Minister used to lead that task force with all of these health specialists and also the policymakers. They used to meet regularly to discuss what is the current situation, what is the next step, and our Prime Minister used to update us at a quiet interval. Look, so that's the thing that we discuss, and that happened. And I will also say they did not just do this thing from the policy point of view. They also consulted with the public health specialists. They also consulted with medical specialists. They also consulted with academics so that they looked at the even the models. Okay, what could happen if they do this restriction, and what could happen if they don't do this restriction? And they tried to showcase this modeling in the media in a very plain language so that common people can also understand. And they took all of these steps based on this scientific evidence. So it's not only any whimsical decision based on someone's intention, but it was based on scientific evidence. Okay, what the evidence is saying. And they also looked at some other countries, what's happening, what are the successful strategies that other countries adopted to reduce the number of cases, or what are the strategies that other countries adopted that eventually failed. So Australia tried to look at all of these scenarios and took all of this decision. I will say that is also another good strategy for Australia.
I have one question, basically, just
Sure.
just from your point of view, because I have few questions. First question is that, as you said, that Australian government, everything they are doing based on scientific research and evidence. Because now people's around the world, actually, we are struggling with medicine, and we are actually thinking about vaccine. What's the situation of research in Australia about medicine and vaccine, as you said about scientific research?
Um, this coronavirus situation is new not only to Australia but in the world. So there has been lots of research going on. And as you know, this is a viral disease, so there is no specific treatment for this disease. So what Australian government did, if because most of the coronavirus situation, 95% of cases, they are very mild, and mild symptoms were there. So Australian government said, look, if you have some respiratory symptoms, it's not necessary that you will have coronavirus and you need to get even tested. Because in Australia at this moment we are going to have the flu season, and so Australian government tried to increase this awareness. Look, so the symptoms may mimic your coronavirus. It could be a common cold or it could be flu. So you don't need to be panic. And even if you have all of these symptoms, if the symptom is not severe, even you don't need to go to the general practice settings or you need to go to the hospital. You can stay at home. You can have the symptomatic management. If you have cold, you can have some medicine for this. If you have fever, you can have medicine. If you have sore throat, you can have medicine. So all of these things are symptomatic management. So they rightly did, because there is no specific treatment for this. Now, regarding the treatment, as you know, and we know from the social media, we know from the example from US, that there has been lots of issues regarding use of hydroxychloroquine, the malaria drug. There has been some discussion regarding the ivermectin, anti-parasite drug. So all of these are really quite early. In Australia, they are doing some research on this thing, but so far there is no scientific evidence for any application of these drugs in Australia. You may know in US, although they have started using this hydroxychloroquine and FDA approved this thing, but they approved this thing only to use in the hospital settings, not in general settings, and anyone can just take the anti-malaria drug and it's going to help them. So Australia even discourage using this one because there are side effects on this. This is number one, getting the use of any specific treatment, because they say, look, you need to have this symptomatic management. But if the symptom is really severe, then they encourage people to come to the hospital and seek medical attention. And in the hospital setting, depending on the symptoms, depending on severity, they used to manage this thing. But there is no specific treatment to treat against this virus. Now, in terms of vaccine, yes, there's been some research going on in Australia as well, like other countries, but it is quite early to tell this one. There has been some trial going on, and for a vaccine development and to have this vaccine, it will take almost 12 to 18 months if we are lucky enough to get this vaccine. So Australia is also doing some research, but at this moment, there is no vaccine. But what Australia is doing, because the flu season is coming, Australia is encouraging people to have the flu vaccine so that the impact of this virus can be reduced. So that is the one thing that Australia government is doing, and encouraging people to have the flu vaccine, so that they can have less impact of coronavirus.
Okay, brilliant. So, I just want to know, when you do research on the vaccine and these things, you are doing collaborating with other countries, other universities, or it's in between Australian universities, or is a specific university working on that? Can you share,
Uh,
as a doctor, as a researcher, this point of view?
sure. Although my work of research is not on the vaccine, so what we are doing in vaccine, different universities work, and they usually do this clinical trial by themselves. There is no something like at the national level, but sometimes there's multi-center study when they involve not only one university, but they involve more than one university or research institute to work on this. But apart from vaccine, there has been some research that's happening at this moment, and I'm also involved in some of the research. So those are about the impact of, especially the psychological impact, because the coronavirus situation is going down now. Now people are started going back to work, and there has been huge economic impact in the meantime during this coronavirus. Many people lost jobs, but the government also tried to support them at least for 6 months. They also supported the business owners. They also supported the employees, employers, and even the international students to support during this pandemic period. But still, there has been lots of issues on this because people lost their job and they are restricted in their movement. So that has a huge impact on their psychology. So what happened now? Government as well as different research organizations are trying to fund those research activities, specifically focusing on psychological impact, and that could be among the community people or also among the healthcare professionals. And I'm also conducting similar type of research at this moment in Australia.
Yes, brilliant. Actually, what do you think about this mental health care situation? Because we are global platforms and we try to bring all of the brilliant people like you, like how it works, how, like example, other countries can take initiative.
Sure. One of these things I will say, at the initial stage, I also try to deliver this message through my social media. The first thing is, in many countries there is lots of misinformation, specifically when in this advanced world we got lots of messages through social media, and sometimes we, without verifying the authenticity of these resources, we always try to share this thing because it attracts our mind, but we don't know whether it is true or not. So if we don't if we don't know the authenticity of those resources, sometimes that creates panic. And unless we know this authenticity of those information, that doesn't help. So that is one information that we need to be aware to get the information from authentic resource. I always share this information. Look, you need to be careful in choosing the information because you can get lots of rubbish in social media, unfortunately. The second thing is regarding the resource available in the current situation and in the country specifically. Say, for example, in Australia, there has been resource, and at the beginning of the pandemic, there was a 24/7 hotline number. So anyone having any issue, they got this opportunity to talk and with any expert mental health advisor. And they used to do this thing through Beyond Blue. There is a big organization. Those support the psychological uh, any psychological status. There was also lifeline number if people are feeling suicidal. There are lots of resources in the website media. And what Australian government also did, they tried to do some apps like coronavirus apps. Australian government encouraged people to download those apps, and in those apps there is also resources available to support the mental health. And if there's any situation, there is a contact number, so they can, with the use of app, they can directly contact the healthcare providers. I think that is also a good initiative. Other than that, if people already have some mental health issues, they are also getting this support so that their care is not disrupted during this situation. Telehealth service was available, and even some of the specialists, they used to do this thing for free during this pandemic situation. So I think depending on the resource situation in different country settings, they can think of adapting any of those examples that Australia is doing.
Brilliant. This is very interesting that you say that lot of informations actually coming. This is not true. Many things actually we observe from media, from social media, everywhere. You are a doctor, you are a researcher. So, like, even though you are a social media influencer, so why you actually choose social media? Because maybe you can be good example for many scholars around the world, and they can bring more authentic informations and more scientific information in this forum. Yes.
Yeah,
What the issue behind that?
I think social media is the most accessible media for people now. Even the literate and illiterate people, they always have this, especially the Facebook, and I will say mainly Facebook. And the user is growing every day. And even if I share my personal example, even our parents who are not capable of using the even the smartphone, they have also started using social media. So that is really good initiative, and this is advancement of technology. So I think it is easy to reach so many people through this social media rather than if you have this excuse me, so other platform. So, and even using this simple message or even sharing the video clip is more influential rather than writing 5 pages of documents. So I think that is really good platform to share, and we can use this media even to, because people can listen. And what I try to do for, say for example, for Bangladeshi people, I try to talk in Bangla language, and even talking with them in layman summary, so that without any technical jargon, so that they can understand what is the key message for this. Because if people understand, if people are aware, then probably they will try to act. Unless some people ignore this because they think, oh, there is no authenticity of this information, or probably it is not going to affect me. So it is really important to reach those people. And sometimes, people are influenced by other people, specifically from researchers or the academics or public health professionals from international settings, and they try to follow those advice. So I think that's a good platform, and therefore I try to use social media besides my other professional roles here.
Okay, great, great. We want to go for more detail. As you are Bangladeshi, live in Australia, so many, I think many, not only Bangladeshi, Asian people also go there. They stay in Australia. It's a many immigrant actually stay there. What's their present conditions? What's their healthcare situation? Or example, what the real situation of the job sectors? What's going on? Like how Australian government give them support, or what the present ecosystem actually.
Specifically for the job, as I told you, that many jobs were lost, and if I look at the figure, almost 600,000 people in Australia lost their job during this pandemic situation. And this also created lots of not only the panic but also disruption in the family lives. And so Bangladeshi communities are not different, or the other Asian communities are not different to this situation. So more or less, many people were affected by this. But what Austrian government did, they tried to support those people who lost their job, or who most of the people who were contractual basis, they used to lose their job. And even specifically international students, they used to work as casual, so they also lost their job. So Austrian government did support and started supporting these international students and other people to give them a minimum amount of salary. And even they tried to give this salary to the employer, and they're saying, look, if you employ these people, this many people, we will support you so that you can support your employee. So that is a very good initiative from Australian government, and they are trying to do this thing for not only for 1 or 2 months, but for the next 6 months. Now, within this, we are in the second or third month of this announcement of Austrian government, and they have, already people have started getting these benefits from Austrian government. So that is one of the issues that Austrian government is supporting them. The other issue is in, I will say, specifically for Bangladeshi communities here, and I'm pretty sure the other communities are also doing. They're also doing some initiatives from their community levels, what they can do for their fellow people, community people. They are trying to do the fundraising, and they are also trying to organize specifically if especially for the international students who are really struggling for job or food, they are trying to do this fundraising and they are trying to distribute those foods. And if there is any opportunity for them to involve in any casual work during this situations with the entrepreneurs who have the capacity to employ a few people, they are trying to support from this level. So that is really good. And other than that, what's happening from the health point of view, from the public health point of view, what they need to do and what they need not to do. I will say, like me, there are many people who are also coming to the social media. They are interacting with people. They're also conducting different sessions and seminars. And I can give you one example. I'm also part of Bangladesh Medical Society of Victoria, where all of the healthcare professionals come under one umbrella. What we try to do, we did an awareness session for the Bangladeshi people here, and then what we try to do, we rostered our schedule every week, every alternate day. So, say for example, I was rostered for a day for 1 hour or 2 hours, and our phone number was there, so anyone can contact us and discuss if there's any issue. It is not about giving specific treatment, but if there's any confusion, any public health advice, we did this thing as a volunteer. And when we started this, then other states, they also have these medical societies. They also came into one place. And then we shared all of the information through the Bangladesh High Commission in Canberra. And then they did the circulation all over Australia. Look, so these are the panel of doctors. And we rostered this thing for 2 months. And our phone numbers were there. It was in the media. So we tried to support the people if there's any confusion, any panic situation regarding this public
Okay.
health matter for coronavirus.
Okay, brilliant. There is a actually audience forum. I get a specific question for you. He is Mohammad Shohel Rana. He say, Dr. Aziz Rahman, if we look at the statistics of the Australia totally, 102 people have died so far and 7,116 confirmed case and already recovered 6,532. So, like example, he asked you a question: if like, is there any possibilities that how like the app are helping people to make this good situation? Like, actually, I think he's from tech industry. So, from tech industry, he just want to know from you how actually Australian software or apps, or what you are talking about, how it helps these ecosystems or implementing this.
One of these things I've already mentioned. So there are two apps that Austrian government encourage people to download and use this thing. The first one, they did this thing about 2 months ago. That's called Coronavirus app. So by using this app, they used to get all of these updates, regular updates, what's happening, what is the number of cases, and what's happening with all of this. Besides this number of cases and what's happening according to each state, there are information what government is doing and what are the support services available in this app. And if there's also symptom checker. If you have any symptom, what you need to do, where you should go for testing, and all of this information are there. So there is, I will say, one-stop place. If there is any information, if you're confused, if you have the symptoms, what you need to do, so you can check the symptom, and if you think, oh yes, the symptom matches, then you can contact, and there is a direct link to the Department of Health website, so they can go in for further details. The second thing is regarding the testing. So if you have the symptoms, whether you need to go to test or whether you need to go to the GPs, there is an instruction there, so they can go through the instruction and then they can follow the advice. And if there is any issue, they are uncertain, there is also a hotline number they can contact. So I will say in this app, they have all of this information. The second app, what Australian government launched about a month ago, that's called COVID Safe. So that means they try to do this thing as contact tracing, and they use this GPS location. So if you download this app, and if there's any suspected or confirmed case near to you, then they can detect this. And then, because if you are in touch and how long you are there, if they get all of this information, they can measure the information, measure the time period and the distance and all of this, and then they can alert people, look, you were in the shopping center, but you came in touch or contact with this suspected case or confirmed case. You need to either stay at home, quarantine yourself, or you need to get tested. So this is the app that's really useful in doing this contact tracing. Now, regarding this app, there are lots of discussion, and there are lots of criticism on this as well, because people are saying, "Oh, why you use this thing, because it is a personal data sharing and all of this." But Austrian government always try to say, "Look, sir, we will not keep this data, and we will not use this data for anything else other than this contact tracing." So they try to build this app with this intention. And I would say, I don't remember the exact number, but lots of Australians have already downloaded and are using this app with this hope, because they are being used for this contact tracing. Now, in terms of these success rates, why there are lots of tests and happening, there's also message regarding through this app, like, "Oh, you need to do this test," and there's also pop-up message, "Oh, you should go and do the test," and even if you don't have the symptoms, even if you have one or two mild symptoms, you can also get tested.
Brilliant. I just want to know more. Like example, what's the frontliner conditions like a doctor, nurse, and the police, and what's their present condition, and how you manage the supply chain, like kit for testings and the lot of precautions, PPE. How Australia actually manage it, because now this is one of the important things. And second things, I want to know the biotech industry, about the biotech industry situation in Australia.
Um, I'm not that expert to comment on the biotech, unfortunately, but I can answer your
Okay.
first question regarding the supplies issue. Now, although it is unfortunate in Australia that we could not expect this thing unless we face this situation, not me, but some other colleagues, there is also shortage of PPE in Australia, unfortunately. So, in terms of, if you think of the testing kit, yes, there has been enough supply for testing kit, and Australian government encouraged that people to get the tested. Even more than 1 million tests, and you can see only 7,000 confirmed cases. So what happened? They have broadened this testing criteria because there has been enough supply for test kits, and they did this test. So there is no shortage for tests. But in terms of, as I told you, there has been shortage of PPE because this PPE was not supplied from central level or from any state government. So each individual healthcare organization needs to manage this PPE. So I will say, in terms of PPE, probably the hospital settings are in a better place because they have enough supply for PPE. But I have seen this thing from my friends and from my networks, in the GP settings or in the allied healthcare settings, there is a shortage of PPE because the GP center owners, they need to manage this PP. They need to buy this PP and give it to the healthcare providers. And I've also heard sometimes they don't have any PP. Just they used to use the mask and gloves, and sometimes they used to use this mask for the entire day, just one mask. So that there's been a little bit of shortage of PPE in Australia. uh, I will say is out of hospital settings, there is a bit scarcity on this rather than hospital settings.
Okay, very interesting. I just want to know, because we are in global world, like, and you are in expert in social media and professional as well. What will be the future of globalization? What do you think? Like already, like every country is shut down, lot of things happening, many problem coming, unemployment, job issue, many things happening. But my question is that, what do you think? What your observations? What you expect next 1 to 3 years?
Uh, the immediate effect that we are seeing, if I think myself just as an ordinary citizen here, our regular lifestyle, how it is being impacted. One of these things, as you have mentioned, in terms of closing of borders and all of these things. So I've seen people are really struggling, specifically the visitors who came to Australia. They struggle to go back to their own country. So that is one of the challenges. The same thing is, I can mention few recent tragic incident for death of elderly people. For those people, even their son and daughter, they could not come to Australia. That was quite tragic and unfortunate due to this restriction. So that really impacted the lives of some of the peoples in Australia. Now, thinking of the global situation, what's going to happen in future, because we really don't know the situation, what's going to happen. Although the case situation is really improving in Australia, and then we are going to ease the restriction. Some other countries there have also started doing the same, but there could be second wave of infection, and we can't predict this one. Although the modeling is saying, or different countries will have different impacts. Now, what World Health Organization has said, probably we need to live with this virus. It is like the common flu type of virus, so we need to live with coronavirus situation around the year until we get the vaccine to prevent this one. Now, definitely our travel is impacted on this. Economy is going to impact. If you look around, say for example, housing prices has gone down, and people are thinking that it will go further down the track. People also have concern, like the government is supporting for 6 months. So what will happen after 6 months if they don't get the job? So there is a concern on this. Uh, some people's studies are also being affected. Some people, they had this expectation that they will come to Australia with the expectation to have this face-to-face education. Now they are getting this online education, whether that is the same as the face-to-face, and whether they will decide to quit the course and go back. Australian universities are really thinking to get more students. Whether they will get more students or not, there's already been a huge economic impact on all of these Australian universities. So I would say all of the sectors are impacted on this, and probably it will take a couple of years to come back to the normal.
Understand. There is another question. As you are talking about telehealth care and this kind of things, like what's the future? How we can work together on this specific industry? So, what's your suggestion? You are also a doctor, so how we can bring in more of the patient in this platform? And is it realistic? You are the doctor. You can give real treatment to your patient by this way. What your actual experience?
So I think in terms of telehealth, what's happening in Australia, because there are pros and cons for this telehealth service. The benefit of this thing is patients don't need to go to the doctors face to face. They can avoid the risk of infection, specifically for this coronavirus situation, and that is also convenient for them just to log in and even do the video conference or the teleconference. So that is really good, and they can get, even if they need to have this medication, doctor can prescribe the medication, and the prescription can go to the chemist house, and then people can go to the chemist and then take the drug from there. Even they don't need to go to the doctor to collect the prescription. So these are really good things. The problem is the doctors are what my doctor friends are sharing. Look, they can't examine the patient. They can't examine the patient and it's not possible to do this thing in telehealth or video consultation. And sometimes the people with chronic disease, they really need to come to the GPs to see what's happening with their situation, whether that is improving or is deteriorating. So it is challenging for through the teleconference. So if you think of the future of this telehealth, and there's also another issue regarding the cost involved for this telehealth or face to face. So although in Australia, what's happening, the Australian citizen and the permanent resident, we don't need to pay. Either if you go through telehealth or if you go through face-to-face consultation. But if it is for the overseas visitors in Australia, they need to pay. Now, we need to think of this limitation of this telehealth service. Yes, professional advice can be given, professional public health message can be given, and specific suggestion can be given, but sometimes it is quite challenging to give specific treatment. And if you think of from the global level, probably it will not be overthinking of prescribing from Australia to a Bangladeshi patient when there are lots of specialties there. So I will say for getting the treatment, I will say need to depend on the country's specific expertise. But if you think of the public health awareness or the message that can be applicable to all of the people around the world, that can definitely be done through telehealth consultation.
Okay, it's actually very good idea. I think we can integrate it by this way. Like what do you think the Asia Pacific collaboration? Let's say Malaysia, Australian relationships, and the Australia and others Asia Pacific countries relationship. What do you think? Because we also think about the economical aspects. So what will be the future? What do you think?
Again, I'm not expert in commenting on the economic point of view, but I can definitely talk about my areas in terms of research
Exactly.
and collaboration for this one. So, what we are doing in Australia, as I told you, the specifically frontline health workers who are at higher risk of having the infection, and they are also impacted heavily through this mental health situation here. So we are trying to do a study or to assess the extent of this psychological stress among these frontline health workers, among the community members, and among the patients. And we are hoping that we are going to start this thing probably in a week or so in Australia, in all the states. So this data will tell us what is the specific intervention that we need to think of for these frontline healthcare workers. Now, I have already expanded this collaboration to Malaysia, and one of my colleagues in Malaysia, he's really keen to collaborate with us, and we have gone forward for this. Now, this ethics application is under consideration. So once we get this approval, probably in a month, we'll also do the similar type of study in Malaysia, and we also got the interest from few other countries. So we are also thinking we can continue this collaboration. But I will say, every situation has both good and bad side. And if you think of this lockdown situation, if you think of this restriction, I will say it has taught people that many things can be done through through online platform. So even you don't need to go somewhere. Even all of the professional conferences that have gone virtual, so we don't need to go to those conferences. Personally speaking, I have a World Congress of Public Health that is coming up in September, in unfortunately in Rome. What they have decided that, yeah, they will go virtual. And same thing happened for my wife. She just attended a virtual conference. So many things that people did not think earlier, so they are getting this practical experience that's possible. So I will say there is a positive impact of this situation, that people are now thinking, yes, we can do, even without any travel, we can do lots of collaboration with other countries, not only for research but also even for education.
Okay, okay, thank you. So I have another more thing, more interesting thing comes. It's a tracking system. I think like Mr. Sohel Rana is just expert on IT. He said that tracking system may be very effective for this kind of things. Anyway, let's move on. Like example, you find that Australia doing very good in healthcare systems. Like example, any other countries, let's say Indonesia, let's say other country, even Bangladesh, even India, because all of them are joining with us. What your suggestion for them for their healthcare system? Even when you see that South Asia, they are struggling a lot. South Asia. So in that situation, what do you think? What's your advice as a doctor?
I will say the first thing is they need to follow the restrictions and the rules in the respective countries. So that is number one thing, because in each of the countries they have the expertise, and depending on the situation, depending on the number of cases, we also need to think of the limited resources in those settings. Yes, we are lucky to live in the developed countries at this moment. They have capacity to test millions of tests, but I do understand that is not applicable to South Asian countries and other settings. But what is
Mhm,
applicable to those settings is what the government is saying regarding the restrictions. People need to follow this. What's happening,
mhm,
what I've seen in the media and the news and the channels, that people are ignoring those messages. So that is the problem. Yes, we don't have the similar resource in those settings, but we have this information. Looking at the successful example, I will say successful example in Australia, when people followed the rules, when people followed the
mhm,
guidelines, then it was possible to get this number down even to the zero. So that is the practical example people need to follow, and then they need to have this trust on government system to follow this public health message. What I am getting that people are, there are two groups of people. In fact, one group of people, they are thinking, oh yes, we need to follow this thing, we need to do this thing, and then they go to the extreme stage. Then they think of not doing anything at that extreme stage. The other group, they are at the other end. They think, oh no,
mhm,
it will not impact us in any way. probably it will impact them when someone near to them are affected, when they will feel someone near to them have died, then they will feel the severity of this disease, because that's happening. And if you think of the situation in Bangladesh or even in India, the people are dying, and people are dying for this complication from coronavirus. And with this limited resource, they are getting less tests, but whoever is being tested, most of them are getting positive. Whereas in Australia, at this situation, we are getting lots of tests, but we are getting very few positive. But we did not come to this stage all on a sudden. We had to follow this restriction. It was quite challenging. It is a challenging period of time. No one anticipated this will happen. So people need to do this sacrifice and need to follow this advice. If they want to be healthy, and if they want to live, and if they want to live with their near and dear ones in the community, there is no other alternative other than following this public health message. So I will emphasize on following the rules, regulations of public health message, and also getting the right information from the right authentic resource. Otherwise, that will just create panic.
This is very important. Authentic information and right informations. Like, how do people actually get authentic information? Because now many things happening around the world. So, what's your suggestion? Do you have any specific process, or in any specific website, or in any specific way that okay, they can follow this. This will be
Sure.
ultimately the good way to taken care of by themselves.
Sure. I'll go back to the same resource, like their government resource, because each of the countries, they also have their own resource. They can look at their government website, and I'm pretty sure each of the country people knows where they need to look for, and they usually update these things. Sometimes, most of the times, they are usually translated in their local language, so they can look at these things. Any people, if they struggle with English, they can look at those local translated version of the resource. Other than that, if anyone wants to look at the international research, there are lots of authentic research. In fact, there has been more information. Eh, People just need to have a goodwill to think of this thing. If they are consistent in looking at those authentic research, say for example, I will say World Health Organization, they can look at this information. They can look at the Center for Disease Control (CDC) information in USA. They provide all of this information. If they want to look at Australian Government Department of Health website, they can get lots of information. So same thing at other organizations, say for example Harvard University, Johns Hopkins University, they also have a very good resource regarding the coronavirus, and all of the questions are answered there. So just people need to look at those authentic resources rather than looking at any online newspaper that does not have any authentic source. So if people are confused regarding this, any question of any situation, they can look at that resource. And other than that, I will say people are now probably bombarded with lots of webinar and interacting with different people. Those are knowledgeable, so they can definitely seek support, or they can pose their queries. And as you have initiated a very good initiative, so probably they can come to you and talk with you. And like you, there are lots of platforms. They should go and seek for accurate information.
Okay, brilliant. One specific things, because you also from Bangladesh, and like example, you understand the cultures and everything of South Asia. There are many underprivileged peoples. Even there are many uneducated people. This amount of people is huge, and financially they are in troubles. Healthcare system, they are in trouble. They cannot follow the specific process. Government try their level best, but this kind of people cannot manage these things. What do you think? How the intellectual community like can help this kind of people? Because these people is not too much of educated. Maybe even they do not follow their government information and policy properly. What's the way? I know this is very difficult issues, but
Yeah,
what's
it
your
is
idea?
really, yeah, it is really challenging situation. On the other day, I was talking with a group of people with Daffodil International University in Bangladesh, and the international director of student recruitment. They are saying, look, so they had lots of students who came from the grassroots level, even from the rural village levels, and during this lockdown period, they went back to, excuse me, they went back to their communities. Even they are involved in the agricultural works at that time to support their families. So in fact, all of the educational institutes, they really have a major role in delivering this message. Apart from the media, yes, you are right, there are lots of illiterate people, but I'm pretty sure that they can access to any media, the traditional media, television, newspaper, they can access this thing. Besides this thing, I told you, social media, even the illiterate people, they also use this one, and even they can't use this one. I'm pretty sure each of the family has the contact with someone who is knowledgeable on this. Knowledgeable in that sense, they have minimum education to understand the message regarding this. So what happens in the community levels? Either they ignore the message. There is, I will not say they don't have the message. I will say they have the message, but they don't have the trust. So it is really important to get their trust on this message. The second thing is, sometimes there are lots of, at this moment, I have heard there are lots of stigma attached with this one. If someone is positive, they try to hide this thing because people will in the community will not take it positively. So these are the stigma related issues are also there. So my suggestion will be, if if anyone knows any information from the authentic resource, they need to share it to their family members, to their community networks, and in that way the message will spread. So I will not say the issue is regarding the availability of the information. The issue is regarding the having the trust on those information in Bangladesh.
Mhm. Yes, very good, very good. Oh, one important things, like example, at present, okay, like you said that we are in phase A, phase one, step by step. We will open up all of the things, as well as you said that vaccine take more time, like 12 months, 18 months period. So, what will be the better strategy next 1.5 years, from your point of view?
Yeah, from my point of view, I will say, because the life will not be in Australia. What the government is saying, the all or what the health authorities are saying, the life will not be normal as it was. So we really, this pandemic situation has taught us many issues, and one of the issues that it has taught regarding the hand hygiene, and this hand hygiene issue is really important to maintain this thing irrespective of this coronavirus situation, because hand hygiene is related with not only for this coronavirus but many infectious diseases. So if we can continue following this situation of hand hygiene, that is practical, that should continue. The second issue in Australia, what they are doing in the face ease of restriction, they are still encouraging people to maintain the social distancing. So I do understand probably that is not applicable in all the situations in Bangladesh, but as practical as possible, we really need to continue maintaining this social distancing. The other issue is regarding the cough etiquette. In Bangladesh, we usually ignore and we just sneeze in front of someone. So if we try to do this thing, even if we don't have any handkerchief, we can use our arm to do this cough. So if we maintain this hand hygiene, cough etiquette, that is one of the good habits they need to continue until we get the vaccine. And even the vaccine issue, we should not just rely on the vaccine, rather than we always try to think of what we can do, because we can think about, look, without any vaccine, what will be the future. We can be really pessimistic on this thing, because everyone is uncertain when the vaccine will come. So people need to follow the other public health message, what they can do from their own level. And if everyone does this thing from their own level as a community, they can handle the situation quite well.
Mhm. So, as per our understanding, that your major focus that people has to prevent their healthcare system by themselves. This is most important. People has to be
Always,
self-educated.
yeah, true. I always say the prevention is better than cure. So, and specifically, it is applicable for the low resource settings like Bangladesh and South Asian countries, because the impact of the treatment is really huge for any disease. And although this coronavirus situation is creating lots of impact, but people are ignoring lots of other diseases. Say, for example, non-communicable diseases, cancer, cardiovascular disease, diabetes, and people are using smoking. People are using all of these things, and there are more people who are dying due to smoking related deaths, but people are ignoring this thing because those deaths come at a later stage of life. But for this coronavirus, all on a sudden people may die, but people may also die due to heart attack. But people are not taking care of those food habits, people are not taking care of the lifestyle, they are not taking care of the physical exercise, they're not taking care of smoking. So I will say people really need to focus on those factors that is possible to modify, and then they can prevent loss of diseases. And one of these things for this coronavirus, I will say, maintain the cough hygiene and maintain the hand hygiene.
Yes, thank you. Thank you for nice sessions. And we want to welcome you and all of your friends and the scholar from Australia in World Talent Economy Forum. And we are trying to create a knowledge-based forum. And around the world, from Silicon Valley to Cyberja to everyone, we are trying to create a better ecosystem. We were trying to build up a strong relationship in between all of the talented guys around the world, and hopefully by this way we can change the world and we can contribute for the global peoples. So thank you for your time, thank you for your very valuable suggestion, very like effective suggestion in healthcare system. So definitely in the future, definitely we will call you again for a conference. We arrange different kind of conference, we do research related works, we engage a lot of tech related issues, and your advice, your guideline will be very helpful for World Talent Economy Forum. Thank you, Dr. Aziz. Thank you for your
Forward.
time and everything. Yes.
Thank you very much for giving me the
Okay.
opportunity. Take care. Thank you.
Thank you.